Okay, I'm Dr. Deuk Majan here at the Deuk Spine Institute, Surgery Center Viera, and he's handing you the IV bag. Our patient is a nurse. She's from the Garden State of New Jersey, where my son will be attending Princeton. Arias will be attending Princeton soon for undergraduate. And she's a nurse, and she was told 13 years ago, you need a fusion on your back. And she didn't want it. She's a nurse. She's seen it. She didn't want it. She's smart. So she found us, and she's just been suffering with back pain. She learned about the Deuk laser disc repair procedure, and here she is, finally her day of getting her back fixed. So that's what we're doing today. Shot? All right. So first step is to get down to the L4-S1. Shot? Let's get some num-num. We're going to give her a little numbing medicine, Novocaine, which, Arias, are you there?
He's here.
So this is the same numbing medicine we were talking about a little while ago with somebody you know who had a procedure done. And very common to give Novocaine or lidocaine with epinephrine. Epinephrine is there to stop the bleeding. Okay. So epinephrine causes blood vessels to narrow. It affects smooth muscle cells, shot, and it stops small bleeding in the blood vessels just under the skin or deeper, shot. Perfect. So we're going for 5-1. Let's get an AP, see where we are. Blood pressure, can we do something to bring it down a little bit? Because she's not bleeding a lot, but she's having some stuff coming out of the pinhole. All right. So we are just lateral to the 5-1 disc. Let's see on the lateral view. Yeah, so we're too far lateral. I think we need to be more medial. Shot? Shot? When I say shot, what I'm actually doing is I'm taking a picture. Shot? That picture is called a fluoro. Shot? That looks good on the lateral view. Let's check the AP. So AP is anterior posterior. It's a front back view on the x-ray. We use x-rays because everything we're doing is relative to the spine. That looks good. And the spine is made out of bones. So all of our navigation is related to the spine. So we're probably about a centimeter behind the disc and a centimeter off on the AP view. Let's see what we can do here. This is definitely her worst disc. I feel the bone. I'm going to try to come a little more medial, but I'm hitting bone. Shot? The bone I'm hitting is the facet joint. And you can actually see, how is she? Is she awake? Shot? I feel the herniation right there. Into the disc, beautifully. Let me have some. So Arias, this medicine right here contains lidocaine, which is a numbing medicine. It literally blocks sodium channels of the nerves. So there's little nerves like roots here under the skin, and they take pain signals from the free nerve endings, and they transmit those signals up to the brain. And by doing some lidocaine, it literally gets around the nerve fibers and blocks sodium transmission through little sodium channels in the walls of the axons. So you don't get the signals going up to the brain. It literally stops them from going up. There's also epinephrine in here, which stops the bleeding, because we're about to make our incision. It's 7 millimeters. So we got lidocaine, we got epinephrine, we got a little marcaine, which is also called bupivacaine. And that is a longer acting numbing medicine. It lasts more than a few minutes. Lidocaine only lasts a few minutes, maybe an hour, 2 max. So 7 millimeter incision. So every surgeon is used to using lidocaine and marcaine. and epinephrine anytime you cut the skin. All right, we've gotten into 5-1. Now we're going to go for 4-5. And this is an interesting case. She came here having a history of 5-1 problems. And when I did her MRI review, I looked at her MRI, and I looked at 4-5, and I said, you know, your 4-5 does not look normal. It's bulging. And I think you're having pain from that. So we looked at the report. The radiologist completely missed the herniation at L4-5 and read it as normal, which of course I didn't think it was normal. Shot? And so I said, let's repeat your MRI. Let's get a new one. She agreed. That was yesterday. And when it came back, we looked at it together, and I looked at it, she looked at it, and definitely there was a problem. And the problem was with the L4-5 disc. Shot? All right, I'm hitting on the bone, and I think I'm just too medial, but let's just verify that. Go ahead and give me an AP. Medial, by the way, is too close to the midline. Medial. Too medial means too close to the midline. Let's go. Yep, too close to the midline. So I'm hitting the top of the back of the facet, which I don't want to. I want to hit the side of the facet. Okay. Let's go back to a lateral. Yeah. L5-S1 is interesting. She has an interesting anatomy. It's different at L5-S1. It's more lateral. Shot? Really? Being forced north. Shot? It's a little better. Don't move around. Just lay still. Shot? Yeah, she's wiggling around just a little bit. Shot? All right, that's better. Shot? Right in the foramen there. Shot? Let's get an AP. Let me know when you're ready. Any questions from our audience?
No current questions.
Yeah, so let's go ahead and share with our audience a video showing how does a herniated disc anyway cause so much back pain. What is the source of that back pain?
Okay. We just got a question.
Well, let's do the video
first? No problem, no problem.
There's the facet. I feel it.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Our patient is just waking up, and we need her awake. And what I mean is she's been awake, but she's been a little sleepy. We're getting her bright and crisp. From looking at her on her telemed, she was showing me where her pain was up in New Jersey. And it was right in this area here. And there's two discs in here, the L5-S1 and the L4-5. So I looked at her MRI, and I could easily see L5-S1 was damaged. It was herniated. It was blocking the foramen on the right with one of the herniations. And I'm looking at L4-5, and it's bulging out, and I'm thinking, let me look at the report. The radiologist missed it completely, called it a normal disc, but it wasn't. There was definitely a broad-based disc herniation. And I said, I think 5-1 for sure, but I think you're going to need 4-5 as well. I think 4-5 is causing your back pain. So she came here, got an MRI, and that confirmed that I was right. There was a herniation at 4-5 as well. Are you awake?
Are you awake? She said yes.
Are you comfortable?
Are you having any pain?
All right. So as I put the 4-5 needle in through the back of the disc, oh, it was definitely a huge tear. I could feel it. There was virtually no resistance. Are you comfy?
She said yes.
So now we're going to do a disc room. How long have you had back pain for? How many years did you have back pain?
13 years.
13 years. So she's from New Jersey. Okay. She's had back pain for 13 years. And nobody's fixed it. She's been offered fusions. Like, I think she was offered 6 fusions. 6 fusions, right? It's either 4 or 6. Pretty sure it's 6. How many fusions were you offered?
4 or 6? 4.
4. All right, 4 fusions. Okay.
What's that?
What'd she say?
4.
4. 4 fusions. Yeah, we got it. So she didn't want it, fusion, obviously. Are you comfortable?
Yeah.
Shot. How bad is that? It's a pretty good looking disc.
What pain score 0 to 10? Please tell us. Huh? 5.
All right. Is that where you typically get back pain?
Yes.
All right. So that's the one that was read as normal. She's getting back. She typically gets back pain there. She's calling it a 5. Okay. And that's concordant. And that's the L4-5. All right. Is it better?
Is your pain better?
Yeah, definitely causing pain. Most doctors.
I'm sorry, what did you say? That hurts?
Yeah, understood. Oh, that's the really bad one. That's 5-1.
Okay.
All right.
Okay, so
All right, we're all done. How bad was that on a scale of 1 to 10? Oh, poor thing. That's 5-1 is definitely the worst one. How bad is that on a scale of 1 to 10? She said 10. Is that where you typically get back pain?
Yeah.
All right. So really interesting. 5-1, clearly a problem. We saw that on the MRI. I think she's even had, did she say she had surgery at 5-1 before? A discectomy or something? Yeah, microdiscectomy. 2010. So her back pain's been longer than 2010. Longer than 13 years. Long story short, she had a microdiscectomy done in 2010, and she's been in pain ever since her microdiscectomy for 13 years. And we knew 5-1 was a problem, but 4-5 was also an issue. We did an MRI, confirmed that there's a broad-based disc bulge, and that's not as painful, but it's also causing her pain. So we're going to fix both. I have a feeling the 4-5 is going to be under pressure. All right, let me know when we can get started. Right now we're putting her to sleep. She's getting propofol sedation, and in a few minutes she'll be ready for us to proceed. Good? All right, I'm giving the green light. Any questions from our audience so far?
Yes, we have 2 questions. This first one comes from Canes25 on YouTube.
This is the dilator. Yes?
And they asked, last week you mentioned you have a fusion today. Do you still do?
Ah, yes, we did. But we moved the fusion. Sorry about that. The fusion is not today. The fusion is Tuesday. The patient wanted to move to Tuesday, so we moved the surgery to Tuesday. Sorry. Henry, do you have a calendar online for our procedures?
Yes, I do.
Yeah.
Yep, I edited it yesterday.
Okay, you got to
It's-
do it a little bit more in advance.
Yes, sir.
Like for Tuesday, you should do it
Week prior.
Well, for Thursday, you should already have it. But for Tuesday and next week, I would do it soon.
No, I already did it for like the next few weeks.
Perfect.
So we're all good.
Perfect. Yeah. So sorry, we had to move the fusion from today to Tuesday. So it'll be in another week. Shot? Is that my shot right there? All right, there we go. All right, so I've advanced this dilator along the guide wire, and now it's sitting at back of the L4-S1 disc, right where her most of her pain is coming from. Shot? All right. I'm going to pull the guide wire back just a little bit so we don't trap it. You're doing great. Lay still. Shot? No, where is it? I don't see it. Is it there? Shot? Yeah, you can't pull it back too far. Let go? That's good. All right, great question.
We have another question.
Uh-huh.
This comes from Buckshot Prepper on YouTube.
All right. What was the name?
Buckshot Prepper.
Buckshot Prepper. All
Yep.
right.
And their question is a 4 millimeter herniated disc considered operable?
All right, Buckshot Prepper.
Correct.
That's a little bit of a tongue twister.
I know, right?
Yeah, 100% of 4 millimeter disc herniation is operable. Shot, I can't see. Because, let's pull back the dilator a little. Because it doesn't matter how small the herniation is, the amount of pain is, you can have a 1 millimeter herniation with debilitating back pain. Yeah. So it's not the size that matters, it's where it's located. And that's good. And the small herniations can be the most painful. This patient's herniation herself is tiny. All right, let's pull it out and see what we got. But it's in just the wrong place. That's the problem. Did you get a shot? Yeah? Okay, fine. Yep. It's kind of like buckshot, right? If you've got one little pellet and it's in your skin, it's not going to bother you. But if it's in your eyeball, it's going to create problems. It's going to bother you forever until you get rid of it and fix it. So these herniations, it's not the size that's important, it's the location. And in her case, it's the annular tear that's the cause of all of her pain. And it's the same thing for everybody. It's the tear and the herniation that's causing the pain. And it's small. These herniations are always small, but significant. Small but significant. All right, let's see here. Yeah. We're going to have to reposition. I'm not happy with our position. Let's see. Let's see here. Actually, it's not that bad there. Let's see if we can work with this and get it done. It's just because of her anatomy, hard to get into her disc. And maybe that's why the first surgeon had trouble. But to me, I'd like to be a little bit more medial. But this is all disc material here. So we're kind of looking at off to the side of the herniation. I think we can get this done. You can see the blue has stained the herniated disc. This disc is pretty degenerated. Her surgery was 2010. So this is an old herniation. And unfortunately, as we tell people who have back pain, the wrong surgery is a microdiscectomy if you have back pain. You never want to have a microdiscectomy. It doesn't fix the back pain. It never fixes the back pain. It might unpinch a nerve and make your leg stronger. It might improve the feeling in your leg. but it's never going to fix back pain because a microdiscectomy doesn't treat the source of pain. So to the guy who was talking about, or the buckshot prepper who was talking about their small 4mm herniation, the reason why no one's going to operate on you is because most surgeons don't understand that a 4mm herniation can actually cause back pain. Okay? They think that you have to have a big herniation to cause back pain, or actually other things cause back pain. They don't even take the 4mm or any of the herniations as the actual cause of back pain, even though that is the cause of your back pain. They just don't know. It's a lack of knowledge. Okay? Spine surgeons are not trained to treat back pain. They're trained to unpinch nerves, unpinch the spinal cord, basically to decompress, to realign, means put your alignment back to where it's supposed to be. That means correct your sagittal and coronal deformities or axial deformity like a listhesis. And they're trained to stabilize with fusions or other type of implants. Okay? They're not trained to fix back pain. So when it comes to fixing back pain, they don't know what to do. They send you to the pain management doctor, or they send you to the chiropractor or the therapist. The problem is those doctors can't fix your problem because it's a surgical problem. They're not surgeons. This is the cause of her pain right here, this thing. And this thing right here is a small herniation. It's about the same size as yours. It's around 4 or 5 millimeters. Remember, the inside of this tube right here is 6 millimeters side to side. So think about that. And the laser fiber you're looking at, the glass, is 1 millimeter. So this thing right here is about 4 millimeters. And yeah, she's not happy. She's starting to move a little bit. She's feeling the pain because this is the painful part of the disc at L5. I'm sorry?
We're doing this entire procedure without narcotics. She's refusing any.
Oh yeah, I understand. Oh yeah, we're by the way, we're not using any narcotics. No pain meds for this whole surgery. Because propofol is not a pain medication, it's a sedative. In other words, this surgery is being done without painkillers. And you know, she didn't want the painkillers. She's a nurse. It's her choice. We respect it. Of course, we thought it would be safe to do. We still do. But we're only using a sedative, no painkiller. So, I mean, the only painkiller we're using is the lidocaine, right? Yeah, no problem. The next one, she was sensitive on this one. This is the more painful disc, 5-1. 4-5 is also painful, but it's not as painful. So, all right, keep the questions coming while I work away. Do you have any more right now?
Yes, we have a few questions. This next one comes from Buckshot Prepper once more on YouTube. And they asked, I just got AS with thoracic pain and lower back pain severe for the last 4 years.
Did they say AS?
AS, correct.
All right.
And lower back pain for the last 4 years. What are my options? I also have foraminal issues in the L4-S1 and sciatica pain. And I also had a laminectomy in L4.
Yeah, so AS, Buckshot Prepper. AS, for those of you who don't know, is ankylosing spondylitis. I don't know if they really have it, but they may. Let's assume for a moment they were diagnosed properly by a good doctor. There is options for you, but for me to tell you what would work for you, I really need to actually see your films, and I need to see you. So we're going to give you a link. Use our free MRI review link there, DeukSpine.com, MRI.DeukSpine.com, and get on there and put your information in, send us your MRI images, and send us the report. There's no way I can tell you what can help you without actually seeing your MRI images, seeing you, where your pain is, seeing your report. So go fill out the form, and we'll be happy to do a MRI review and consultation, all right? Great question. And that's for anybody out there. We offer a free MRI review. And we can tell you what's wrong or tell you what needs to be done. If we can't tell you what's wrong in the consult, we'll tell you what other tests are needed or what other diagnostic procedures we want done. But happy to try to help people around the world. We have a lot of people from around the world using that service. All right, any other questions?
Yes, we have a question from Doug Dean on Facebook, YouTube, excuse me. And Doug asked, can you walk us through what a typical recovery timeline looks like after your procedure?
Sure, Doug. So Doug is asking about recovery from the procedure. I'm going to assume that we're talking about lumbar, the lower back, not the neck, not thoracic. But for the lower back, typical recovery is 1 hour. And the patients are gone. They leave. They go back home. They go to their hotel. They need a driver to take them. They cannot drive themselves. You've just had anesthesia, so you need a driver for the first day. And that night, within an hour, they're going to be up walking around. You can go for a walk on the beach. You can go to dinner. You can have a nice meal that same day. The next day, you can drive. You can go shopping. You can go on a plane. You can do whatever you want, except you cannot go back to playing physical activities like football, soccer. If you're a professional athlete, you're going to have to take some time to heal. So the recovery is literally 1 hour, and then the healing, where the disc is healing, it literally takes 1 year to fully heal that disc. Okay? So in the first year, you can actually easily re-injure your disc if you do too much. You can re-herniate it and re-blow it. Okay? And that has happened. About 1% of our patients with the DLDR will re-herniate, 1 in 100. And we've had about 1 in 100 re-herniate, and it's no fun because they have to have another surgery. So I tell everybody, take it easy, follow the restrictions, you know, while your body is healing, and give it time. A lot of people go back to work the next day or within a few days. They have desk jobs. You can't go back to a manual labor job right away. You have to give it time. So a lot of scar tissue here from her prior surgery, but also what I'm seeing besides the scar tissue is a re-herniation. So she's re-herniated, and that's what I'm working on getting out right now. I apologize for the poor visibility, but that's more of a function of the fact that she's had prior surgery before here. So of course, with that prior back surgery, the microdiscectomy that didn't really work, that is causing some of the bleeding. And don't move, come on, hey. She just moved a little bit too much. So the bleeding that you're seeing is tiny, tiny bleeding. It's minuscule, but it clouds up the water. You guys see how the water is not clear? That's from that tiny little bit of bleeding. Yeah, she's very sensitive here at this disc. Almost done. Maybe she's hiccuping. It could be hiccups, you know. I've seen hiccups do that. Could just be hiccups, hopefully. Very sensitive? Okay. So far everything's going well for her. Remember, she did not want narcotics, so we're not giving her narcotics. And without narcotics, there is going to be a little more discomfort. This is a calcified herniation right there. You guys see that? I just took it out with the laser, how quick and easy. That's a herniation. It's become basically a spur. All right. Now, have we run the video on how the Deuk laser disc repair actually works?
Just back pain.
Let's go ahead and do that video so people can learn about how this surgery actually fixes people.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. We're just inspecting the work. We're just about done. And I mean, just unfortunately, the prior surgery she had, the microdiscectomy, has done a lot of damage back here to her back of her disc. But I think we've gotten out what we need to give her relief for her back pain. I think she's going to be really happy with that. The rest of this is just scar, some thickened ligament, which I've had to cut a little bit of the thickened ligament out. And that's it. All right, let's clean this up. So we're done at 5-1. I'm satisfied with the results. We're going to do a little disinfectant called betadine. Now, you said there was another question?
Yes, no, not a question, but is for seeking help or advice. This is from Buckshot, once more on YouTube. And they said, my doctor has ordered new MRIs with and without contrast, and I am very curious about having a consultation with you all. The doctors that I've seen don't know how many years I've been in pain. Want to touch me regardless of my pain level and how many years I've been in pain. I will send you all the information in that link. Thank you very much.
Sure, Buckshot. So listen, you know, if you have ankylosing spondylitis, obviously, it's a horrible condition where your spine fuses itself over time. And the thing about it is that patients with ankylosing spondylitis, primarily treated by rheumatologists, and there are some medical treatments, I think, that are getting better for that condition. And the rheumatologist is a doctor that can help with that. But ankylosing spondylitis patients also get other causes of back pain that everybody else gets, like herniated discs or stenosis, which causes leg symptoms. And more importantly, they also get fractures, okay? So if they have a fractured spine, it'll cause pain, and it's also highly unstable. It needs to be fused if you have a fracture. So I'm very curious to see your films and figure out what's going on to try to help you. But fractures are the biggest risk in patients with ankylosing spondylitis. Suddenly they'll have more movement and they'll have pain. And that's usually a fracture. All right. So we're going to do 4-5 next. We're done with 5-1. I'm happy with the 5-1 results. And now we're going to go to 4-5. 4-5 is a relatively normal disc. It's got normal height, but there is a tear, and we saw that on the MRI, and there's bulging. Yeah, I'll give some number. Let's do some Novocaine. So hopefully we're not going to need to take too much herniation out. There's not a lot of herniation at 4-5. Shot. We're just going to clean her tear up. Shot. And it looks like from the pictures that she's tried healing her own tear. So You can see that on the MRI too. Definitely a tear, definitely a small herniation, but it looks like she's trying to heal it herself, which is good. Shot? So. And I know she's got a tear because when I put the needle in, I could feel it go in quite easily. Shot? Yep, that's good. So 4-5, my belief is that she has a tear, bulge, and that her body is trying to heal that. And it's done a pretty good job, except it's still painful. And we're going to go in and clean the tear. She's going to re-heal it. Lay still. Yeah, see there's so much pressure in there, it's pushing the dilator back. So I'm going to have to go and put the dilator in a little bit more. Shot. Yeah, look at that, just pushing the dilator back. So this is a condition called internal disc disruption. We do see it, and it's pain from basically inflammation inside that disc, putting pressure on the disc itself. And what we're going to see is a lot of blue dye stuck to the degenerated nuclear material, and it's going to, the way I like to describe it is like an internal explosion where the outside of the disc looks relatively normal, but it's not normal. It's obviously herniated. And most surgeons would just pass it by and not treat it, which is why so many people still have back pain after their surgeries. Not here at Deuk Spine, but elsewhere. All right, there it is, exactly as I expected. That blue stuff should not be staining blue. That should be white. The fact that it's blue means it's degenerated nuclear material. That only happens with a herniation. I've seen this so many times. And look at the pink tissue right there. That's granulation tissue. That's where all the inflammation is. All right. I don't expect to be here too long. 5-10 minutes max. But this disc definitely needed to be fixed. And I'm glad we're doing it. Look at the scarring. See the white stuff? That's scar tissue. It's really easy to see when the nuclear material is staining blue. Look at all that blue. That is all degenerated nucleus. Only degenerated nucleus stains blue. Now, the big body of white stuff, this white stuff is scar tissue right there. You see that? I'm hitting it right now. You guys see that scar tissue? But you see the white down there, the really deep white, the big streak of white? Trying to focus. See this way down here? That is normal nuclear material. The blue is abnormal. All of this should be white. So I'm leaving the white stuff. I'm taking rid of the scar tissue right here, but I'm going to leave the nucleus that's normal. Wow, incredible, huh? You could just see it. So obvious too. All right. There's your tear. Wow. This is all torn annulus that's got inflammation and scar tissue in it. So remember, these disc herniations are inflammatory conditions. That's what causes the pain, inflammation. It's not pressure on the nerves like these doctors think. It's not. It's not pinched nerves that cause back pain. Back pain and neck pain don't come from pinched nerves. That's why doctors will unpinch the nerves with surgery and the patients still have back pain, because it's not pinched nerves that cause back pain. It is the annular tear that's inflamed that causes the back pain. That's what we discovered here at Deuk Spine. We've been trying to teach other surgeons and doctors and patients about it. By the way, at this disc right here, I don't think she even has a pinched nerve. On her MRI, there is no pinched nerve. Look at that. That's the tear. See the pink stuff? That's where all the inflammation is, the pink stuff in the tear. This is the outside of the tear. We got about a minute left, doctor. A minute. Once I clean this tear, she's going to be able to heal it properly. You know, she's a nurse, and she understands what a debridement is. You know, we get patients coming to the hospital, they have ulcers on their legs, they can't heal them, or they have postoperative ulcers, they can't heal them because there's all this necrotic inflammatory material there, and the skin won't close over it. The tissues won't heal properly. So as a surgeon, we have to go back and do what's called a debridement, where we actually go in and clean out the junk off all that inflammatory junk tissue that's keeping it from healing. And then guess what? It heals, and it heals beautifully. So typically with those superficial wounds, they'll heal in months. And the disc takes a long time to heal because it doesn't have a very good blood supply. Okay, but yep, it's looking good. Just about done. This is the annular tear right here. Looks like a mess. Normally the annulus is very highly organized. 25 layers of collagen concentrically organized. There's the epidural space. A little bleeding from Batson's plexus. Nice. All right. There we go. So you can see the epidural fat, little vein right there, no big deal. So we're at the outside of the annulus. I told you there was a tear, but she's tried to heal it. That's what all that scar tissue is. And it needed to be fixed. I need 1 minute, we're done. 1 minute. This will all be healed naturally after surgery. She'll heal it over the next year. Okay? And I need 10 seconds. I don't need another irrigation. I'm done. Yeah. We're done. All right, any questions, folks? The nice thing is that she is a nurse in New Jersey. So if she watches this video someday, look for Arias, my son. He's going to be in Princeton starting in September. So you might actually run into him. Okay, we're all done. Lights on, scope off. We're going to do a little betadine. Irrigate it out. Any questions from our audience?
You're all done.
No current questions.
She did great. She did great. Yeah. So you've never done one without narcotics? No narcotics at all? All right. Let's go ahead and type your questions up, folks, for me, and I will be happy to answer them. I'm going to put pressure on the muscles for a few minutes so we don't get any kind of muscular hematoma. Muscular hematomas, if you let them get really big, they can be a problem, and they could require surgery, but small muscular hematomas just cause pain and muscle spasms. So sometimes I'll have patients, they'll have some pain around the incision, tenderness that goes on for a few weeks. That's a small blood clot in the muscle from the surgery breaking down, releasing hemosiderin and irritating the muscle fibers, causing muscle spasm and inflammation within the muscle. So I try not to get any hematoma in the muscle by just putting pressure and stopping any venous bleeding. I hold that pressure for a few minutes, usually 4 minutes, and then that way they don't have those small hematomas or blood in their muscles, so they don't have that pain afterwards. You're doing great. You're just waking up.
You're all done.
Okay? Any questions, type them up. I'm going to come answer them for you. But our next patient is a single level Deuk laser disc repair. And he's from the Space Coast. This patient here is from New Jersey. Our last patient was from, no, he was from Idaho. And our first patient, the cervical, where was she from? Merritt Island, that's right, Merritt Island. That's where NASA is. All right, all done, beautiful, 7 millimeter. Keep the pressure for another 2 minutes. And surgery went very well. Let's go ahead and show a testimony, and I'll come answer questions. So type up your questions, folks.
All right, I'm here with one of my patients who traveled from Australia to Florida to the Deuk Spine Institute for treatment. And you look happy today.
Yeah.
Yeah? Why are you so happy?
I'm happy because my back pain is gone.
Your back
and,
pain is
and
gone.
my leg pain is gone from
Awesome.
the disc. Yeah.
From the surgery yesterday.
Surgery yesterday. Yeah.
And you had the Deuk laser disc repair.
I had the Deuk laser disc repair. Yeah, that's right. Yeah.
So why did you come all the way to Florida from Australia for the Deuk laser disc repair?
I've been suffering from back pain and leg pain for nearly a year after an accident. So I did a lot of conservative treatment like physiotherapy, exercise physiology, but it hasn't cured my pain. The pain was chronic, and I've been suffering from a lot of issues, emotional frustrations and things, and sleepless nights. But a couple of neurosurgeons back in Australia has offered me a surgery. They both offered me a fusion, which I don't want to go for. So then I have looked into Dr. Deuk. I found Dr. Deuk, and he's doing an amazing job doing a laser technology and also doing very minimally invasive procedure. So I thought this is what I wanted, and it's a faster recovery. I could go back and work back within a couple of weeks. So that's why I traveled all the way from Australia to US.
Yeah, and we did your surgery just yesterday evening.
Yeah.
So it's around 12 hours now from the surgery, and your pain is gone. And you can see in the video here where we did the laser surgery, we got into your disc endoscopically, and we used the laser to clean the tear in the back of the disc at L4-S1 where their pain was coming from all the inflammation. And now that back pain is gone. And you didn't have to have fusion. You didn't have to go to the hospital. You didn't have to deal with narcotics, right? You said you took a couple of anti-inflammatories and a muscle relaxer yesterday.
Yeah, but I didn't have much pain about with the surgery because it's laparoscopic and minimally invasive, I believe.
Yeah, that's correct. That's correct. So there's not a lot of trauma. There's no scar tissue. There's just a little incision. And of course, we don't remove any bone or ligaments from the spine. It's all done minimally invasive and naturally. So it's a natural healing of the disc. Now, you said just a minute ago you were suffering with a lot of pain and the effects of pain on your psychological well-being. And I know what you do. You're a nurse who helps patients that have behavioral issues, like anxiety, depression, and maybe other things. But you can appreciate how devastating chronic pain can be on people and their loved ones around them.
That's true. Yeah, I completely agree. It not only disturbs you, also your family. That's what I understood. So psychologically, after a few months, I should say, you will have that frustration of chronic pain, and then your behavior start changing towards others as well. And it's not only about you. It's also about your people living around you. That's very important. Yeah.
You came here for a purpose. You got your surgery that you had hoped to do. Now you're going to go back to Australia.
Yeah.
You got a long trip ahead of you coming up. And how do you feel about your experience here at Deuk Spine overall?
Oh, it's really good. Staff is really welcoming, and it's spot on, and they receive you with a smile, and which is really great. And my father was telling, it's amazing how he never thought that in American health system, people like the clinicians are like this. So he was treated differently probably before while he lived in US, but it was really amazing, and your staff is really cool.
Thank you.
Say. Yeah, they're welcoming. They're good.
Thank you very much.
And you are the best. I
appreciate it. It's an honor to take care of you, and it makes me feel so satisfied to see you happy and out of that pain. So congratulations.
Thank you, doctor.
You're welcome.
Yeah. If you're suffering from back pain, this is like a very good cutting-edge technology and very advanced surgery, which Dr. Deuk has developed his own, and without minimal, no damage to the bone, no damage to other things, and easily approaching to the disc and removing it. He is very skillful in reaching there without, manipulating any of your muscles or anything. And you can see from me that I have recovered within few hours after the surgery. So I would say if you don't want a long-term complications from the surgery, this is the best surgery you can get done by Dr. Deuk here.
Congratulations once again.
Thank you, doctor.
Dr. Arjik Majan here at the Deuk Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Deuk Spine Institute?
Dr. Deuk, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration, where I could maybe get up, like stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And like I said, I was scared to death.
The problem with pain management, unfortunately, is that it doesn't fix the issue when you have a herniated disc and back pain from a herniated disc, because you need surgery on that disc to repair it. That's what the Deuk laser disc repair did. And you can actually see here that we went into his disc with the endoscope and we were cleaning out the herniation with the laser. And the laser actually makes a huge difference. People say, oh, lasers, they're not used in spine surgery, but they are. And they're very, very powerful tools and very precise. So we were able to clean out your discs, remove the herniation. And how do you feel today?
I feel great. I mean, it's probably, I mean, I know I'm on camera right here, but I literally could not walk into the office yesterday. And I would just, I mean, you're gonna see my shorts and everything, you'll have to edit, whatever, but I'm able to walk.
That's awesome.
And I'm just, it wasn't even close. I was actually, and I don't know if you can tell from the camera that what my personality is, but I try to be very polite, and I was apologizing for profusely sweating because I hurt so bad. It's not because of the Florida heat by any means. It's because I hurt so bad. I never experienced pain like that. And like I said, there's no
because you're a redneck too. You know, you're not that far from Florida.
That's
you're
right.
Just up a state or two, right?
That's right. Yeah.
A couple of states. So you're feeling better today. It's been less than 24 hours since
Yep.
we did your surgery. You went home an hour after the surgery, back to your hotel with your
Yep.
lovely family who I met.
Yep.
And how do they feel about your progress?
They're happy that I'm happy. You know what I mean? Because they were scared too. You know, now they were putting on a strong front, but I am just telling you, I was at my wit's end. And I certainly are a lot more appreciative of people who have pain that I'm aware of, because when there's no rest from it, oh my gosh, you know what I mean? I was really at my wit's end, and you saved me. So I appreciate you very much.
You are welcome, sir.
Yeah.
Is there anything else you want to say to your fans out there?
Thank you. Sorry, I could have prettied you up for you a little bit better. So just had surgery yesterday.
All right.
Cut me some slack.
Excellent. And you're heading back home today, correct?
Yeah, right, going back on the plane later this evening. The kids are going to swim a little bit down here in Melbourne. I am just going to rest and watch TV, but then we're going to get on the plane a little bit.
Awesome.
Yeah.
All right. Well, congratulations. You
Yeah.
had faith.
Yes.
Took the
I have
leap
faith.
and you got the surgery done.
Yes, sir.
All right. Awesome.
All right, well, we have just completed 2 discs that were causing pain for a patient who traveled here from New Jersey. She's a nurse. She had been offered fusion in the past. She didn't want it. We're going to fuse L4-S1. 2 things to think about with her. First of all, if you fuse the L4-S1, that would have helped a lot with her pain, right? because fusion also works, but nobody really wants a fusion. Second of all, if they had fused L5-S1, she already had a tear at L4-5 with a disc bulge, disc herniation, and we saw that when we were in there, and that disc was actually still causing her pain. Not as much as the bottom one, but it was about half as much. And that pain would still be there when she had a fusion. And guess what? That disc is going to wear out faster now because she had a fusion. Because fusions cause people to wear out faster at the discs above and below. So she did not have the fusion, she had the laser instead. She's not going to get adjacent segment disease because you don't get adjacent segment disease with Deuk laser disc repair. And she made the right choice. She's going to do fantastic. Just so you know, our earlier patients have already gone home. We had the gentleman from Idaho who had the L3-4, L4-5 DLDR. He has no back pain. He's doing fantastic, very happy. And then, of course, the lady from close by where she had the 2 herniated discs, she's already gone, very happy. One of our viewers is a comment from Joseph Chaves, who says, you had the procedure done a while back, I remember. I cannot discuss your case at all. We cannot discuss patient information. So I'm going to assume for a moment what you're telling us. You had the procedure done. You're saying that you're still having pain. You're still having pain because it's coming from somewhere else next to where we operated, or you've re-herniated your disc. So it's one or the other. You know, 1,600 of these surgeries, I don't see ever failures where we operate. In other words, if somebody has an L4-5, L5-S1 pain, and we confirm that in the operating room, and we do the laser surgery, it always takes that pain away, every single time. Now, can people have pain coming from above or next to where we operate? Absolutely. Can people have pain come back because they did something they weren't supposed to do and they re-herniate? Absolutely. We see that happen all the time where people have pain nearby. Usually around 20% of patients will come back, they'll have facet pain or SI pain, and we'll figure it out and we'll treat it. But some people don't want to come back, don't want to figure it out. They're happy to live with less pain, and in those cases we can't help those people. And some people will break the rules, they'll do things they're not supposed to do, and they'll re-herniate. So, to Joseph Chaves, if you are indeed a patient of ours and had the procedure, happy to have you come back. We'll figure out what's wrong, and you may require additional treatment, is what it sounds like. Hopefully you haven't re-herniated your disc.
Okay, and then the next one is, this is not a question, a comment from someone else on YouTube.
Someone else on YouTube?
I love that name so much. And they said, unfortunately, I am too far away. If I was in Florida, I would make it to the operation.
All right, so someone else on YouTube. Thank you for the comments. And I hope you've enjoyed the surgery. If you have any questions, just quickly type them up. If not, we've got another Deuk laser disc repair coming up in a few minutes. And this gentleman has an L5-S1 disc that we're going to go in and repair and unpinch his L5 and S1 nerve roots. And then we have one last case today, which is going to be the Deuk plasma rhizotomy. This is a patient who actually had the Deuk laser disc repair done. No longer has disc pain, but he has facet joint pain right behind the disc. And he's here for the rhizotomy that we do to treat facet pain. I can tell you this, for people that have had the Deuk laser disc repair, if you have pain afterwards, the most common reason is the facet joints. The Deuk laser disc repair only treats a disc problem. It doesn't treat arthritis in the facet joints. And a lot of patients who have injuries to their discs also have injuries to their facet joints. Doesn't mean they're going to have facet pain, but many of them do. Around 15 to 20% do. And we're going to have to treat that afterwards. So if you're watching and you've had this procedure, you've either re-herniated or you have adjacent another disc that's gone bad, or you got facet pain or something else is going on. But if you're having problems, give us a call. We're happy to help you out.